Vanderbilt University Medical Center is one of the nation's leading academic medical centers. We're dedicated to advancing healthcare through research, education, and patient care, and our supply chain is a big part of that mission.
Cross-functional collaboration is key, especially when you're moving to systems that are integrated. Our teams have partnered together much more extensively than we have in the past. We now have a much broader understanding of each other's world, so minimizes questions if you understand the financial impact of those actions on the front end and understand that standardizing those processes is of critical importance. That way you get the right results the first time.
We're using advanced technologies in surgery, but we were lagging behind on supply chain technology. We had an antiquated point-of-use system that was due to sunset. We also knew that the organization was selecting a new ERP system, which then meant that supply chain would have to pick a point-of-use system that would integrate with the new ERP system. We knew we wanted a system that would show us movement of supplies from one department or one storage location to another, track and provide great data so we would understand our movements, understand our usage, understand our spend. So we needed something robust that was going to meet our needs and also take us into the future.
This is just not another software installation. This crosses your entire hospital, from finance, supply chain, materials, your clinical teams, even the surgeons that will not be having a hands-on. It impacts your entire organization. So it is very important to involve leaders from all of the different departments in the conversations that you have.
Before this project, I knew that supply chain was the people that got us what we needed. But I had no idea how many steps were involved in getting us what we need. And while our process before was very easy for the clinical staff, it probably wasn't that easy for our supply chain people.
We started our support system from the very top, engaging our leaders in our steering committee. And then we started a voice of the customer with our super users and their leaders. We had super users from clinical, we had super users from finance, from supply chain and material management to get real-time feedback.
When we actually went live, we had them, they would just go from OR to OR to OR to help people. One of our great super users, he did a lot of work on the decrementation pathways. His little tweak was that we need to use nurse-friendly names for our locations, and that got us very far in the system.
Our systems before we implemented did not allow for real-time tracking. It did not allow for really good transparency, and so this transformation has gained a lot of those things.
It's giving us visibility of supply movement. It's allowing us to capture data that we didn't have in the past. Our reporting capabilities are much more robust so that we can make sound financial decisions for the organization.
Changes that the clinical staff has seen in the operating room is improvement in documentation from this modernization. So the information that they are putting in on implants and tissues easily flows into our medical record, which in the past they would have to double and sometimes triple document.
Data integrity was a huge focus for us. We worked with our implementation partners to really clean up the data before implementation. They were looking at our SKUs, they were looking at our item numbers, making sure that our vendors were in there correctly. There's a lot of behind the scenes work that our data team did.
At the beginning of this transformation, leadership from several departments were not particularly happy with the transformation.
Everything was called a different name. It had new item numbers, and a lot of the clinical staff had remembered their old item numbers. They had to learn the new ones. And also the same situation was happening with our supply chain. So it was a large learning curve.
Now, after 2 years of being on our new point-of-use system, leadership has changed their mindset. They are able to see the financial transactions more clearly, the impact of their choices on supplies that they make, And supply chain is also able to provide robust, detailed data that helps guide financial decisions.
We're not done supporting the evolution of this modernization. We are working weekly with our leaders to look at the issues that we are facing and to look ahead.